Parents of preteens and teens have been asking me some pointed questions about the vaccination to fight against human papillomavirus, or HPV. Well, let me take my best shot and talk about the HPV vaccine. The HPV vaccine is targeted against human papillomavirus, a sexually transmitted infection that causes genital warts and cervical cancers in women and causes genital cancers and cancers of the mouth and throat in men. But what's interesting is it doesn't cause these cancers right away. It can linger for years inside our bodies, particularly if we're not vaccinated, only then to do its damage. So we can pass this organism from one person to another and not even know it. In fact, it's thought that 50% of women in this country who do not get the HPV vaccine will carry this virus at one time or another. Now, what's important to note is the vaccine works best when it's given before someone is sexually active, which is why we recommend giving it at age 11 or 12 as a series of 3 shots given over 6 months. But it can be given all the way into someone's 20s if they missed it, so it's important to think about getting this vaccine at any time during adolescence or as a young adult. So are there complications to this vaccine? Well, we're not giving the actual virus itself. We're giving killed parts and pieces of the virus so that whoever's being vaccinated mounts an immune response to protect themselves from actually getting the virus itself should it get into their system. In addition, we find out that the only side effects we know of from the vaccine are a little soreness at the site of injection, perhaps a low-grade fever for a day, and a sense occasionally of feeling faint when you get the vaccine, but that passes quickly. What's important to tell your teenager when they get this vaccine, and I hope they do, is that they're not protected against other sexually transmitted infections. So they're going to need protection if and when they decide to become sexually active. In addition, the vaccine does not protect against all strains or types of HPV. So it's still important for women to get a pap smear when they're old enough to still monitor for the onset of cervical cancer. So that hopefully tips like this, and not just sharp tips, will stick with you and most importantly with your teenagers when it comes to recognizing the importance of getting them vaccinated against HPV. This is pediatrician Dr. Lewis First reminding you to always be first with your kids.